Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Hepatitis C is a virus that attacks and damages your liver. Now, many people living with hepatitis C infection experience no symptoms or even very mild symptoms. This changes when they develop serious liver damage, and that's why it's called a silent killer. According to the Center for Disease Control, approximately 3,200,000 Americans are infected with chronic hepatitis C. They can't get rid of it. And up to 75% of these people do not know they are walking around with it. Because they are not getting diagnosed and it isn't discovered until liver damage occurs, it may become a very serious situation. So welcome to my podcast, Hepatitis C, What You Could Do to Help Your Liver. Over the course of this episode, I will describe the extra things you can do above and beyond your doctor's prescriptions and recommendations to help your liver. So, hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I've studied nutrition. I'm over here at Invite Health. I'm also the scientific director, and I'd like to talk to you today about, hey, your liver health, hepatitis C, who's prone to it, what you could do about it, how to help your liver. Please subscribe to the Invite Health podcast, and please leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get going. Now, the following is taken from the CDC website. The CDC is down in Atlanta. It's the Center for Disease Control. Hepatitis C is a liver disease caused by the hepatitis C virus. When someone is first infected with the hepatitis C virus, they can have a very mild illness with few or no symptoms, or they can have a serious condition requiring hospitalization. Now, for reasons that are not known, less than half of people who get hepatitis C are not able to clear it out of their symptoms. They can't get rid of it. So the virus, without treatment in the first 6 months after infection, can become chronic, lifelong, very hard to rid yourself of, and can become quite dangerous. So most people who get infected will develop a chronic, that means long-term, or lifelong infection. And left untreated, chronic hepatitis C can cause serious health problems, including liver disease, liver failure, which is called cirrhosis, sometimes liver cancer, and even death. Because of this, according to the CDC, all adults, all pregnant women, and people at risk factors for developing hepatitis C should get tested for hepatitis C. So that includes my age group, the baby boomers. When I was young, they knew about hepatitis A, which is kind of like the flu, and they knew about hepatitis B. And in the 1980s, they knew there was something going around among people who were having surgery, who were getting blood transfusions, and they were calling it non-A, non-B hepatitis. And they didn't figure out until like the late 80s how to test for it, and then they named it hepatitis C. So how is hepatitis C spread? It's usually spread when someone comes into contact with the blood or the fluids from an infected person. So, sharing drug injection equipment. You see this with people addicted to heroin. So sharing needles, sharing syringes. Sometimes it happens at birth. About 6% of infants born to infected women develop hepatitis C early on, but of course they could treat it. But healthcare workers. Now, it's not common, but if a healthcare worker jabs themselves with a needle, it can happen. If you have sex with someone who's infected with hepatitis C, it could spread during sex. It's not common, but it's reported. And this is usually men who are having sex with other men. It's not usually men with women. Also, if you go to a place that's not licensed for giving tattoos or body piercings. So, if you go to a place that's an unlicensed facility, they're not using sterile equipment, they're reusing equipment, it's a dirty place, you could get hepatitis C there. Of course, you can also get hepatitis B. Sharing personal items with someone who's infected. Like, the glucose monitors that you jab your finger with, or a razor, or even a toothbrush or a nail clipper. Anything that's come into contact with their blood. Most of the people with Hep C had blood transfusions or organ transplants. So before 1992, when widespread screening for hepatitis C was enacted, it was spread through blood transfusions. I've been in the pharmacy and nutrition industry since the late 1970s, and we had a lot of people coming in the 70s and 80s who had hepatitis C, and it was really hurting them because they didn't have the modern drugs like ribavirin that they use with interferons that helps clear out the hepatitis C. They didn't have the drugs they're using today. So many people with hepatitis C, they don't really have a lot of symptoms. They don't know they have it. They don't know they're infected. Now, if the symptoms occur, it could be, something obvious that it's the liver, like yellow eyes and yellow skin, or the urine becomes dark, or your poop gets light-colored, like clay-colored. But you can also have a lot of intestinal problems, like you don't feel hungry, fluid can build up in your abdomen, you could have an upset stomach, you could throw up, you can have stomach pain. And then there's symptoms like a fever, feeling tired, having joint pain, confusion. Some people when they get confusion, they develop slurred speech. That's called hepatic encephalopathy. But they get itchy skin, they bruise easily. Their legs could swell, they can experience weight loss. Sometimes they get something called spider angiomas. Like your blood vessels on your skin look like spiders. Now, early on, it's highly curable. Hepatitis C is very highly curable early on. So if you have the symptoms, you really need to contact your doctor right away before it becomes a chronic disease. And they use direct-acting antiviral medications today. I'm a pharmacist also, besides being a nutritionist. So it's usually over a 3-month period, they give you drugs that directly act on the virus. And this can cure early acute hepatitis about over 90% of the time. So 90 out of 100 people, like they use drugs like Harvoni or Vicirapec. And these work directly on the virus. They help clear out the virus. Now, if symptoms do appear, I'm probably going to have to split this episode into 2 parts. If symptoms appear with a new infection, they usually appear within the first 2 weeks to 3 months. But the symptoms can take up to 6 months to develop. So if you have those risk factors that increase your risk of Hep C, you should get checked for it. You really should. Because getting tested is the only way to know if you have hepatitis C, and it's not commonly done. So people with chronic hepatitis C, they can live for years without any symptoms or feeling sick. But when the symptoms appear for chronic hepatitis C, it's usually tied into severe liver disease, advanced liver disease. The liver is really messed up. So there's a blood test called a hepatitis C antibody test that could tell you if you've been infected with the virus, either recently or in the past. And if you have a positive antibody test, there's another blood test needed to tell you if you're still infected. Or also if you were infected in the past and you totally got cured. Because some people, I think about 25% of people with hepatitis C will be cured on their own, but not most people. So getting tested is really important. It's life-saving. So there are things you could do that are above and beyond what your doctor's recommendations are and what the drugs are. Now, what are the common complications of hepatitis C if it becomes advanced, like after 6 months? You could have scarring of the liver. That's called cirrhosis. So it can be in you for years without causing significant complications, but eventually it can lead to cirrhosis. After years of having the virus chipping away at your liver, because the scarring of the liver makes it hard for the liver to do its job. Like one issue is your liver has these reticuloendothelial system. It's like the liver's own immune system. And there's these huge stay-put cells in the liver lining the liver blood vessels, the hepatic blood flow. They're called macrophages. They start out as smaller cells, and they eventually will move to the liver, and they stay put, and they grow into these huge cells, and they gobble up the viruses and toxins and pollutants in your food. So when your liver is damaged from hepatitis C and you're starting to develop scarring, you're starting to develop cirrhosis, one of the things that happens is the immune system of the liver can't clean the toxins and the viruses and the bacteria out of your food, and you could get a blood infection which can affect your kidneys or your heart. So these people are frequently they're put on antibiotics, etc., to help prevent that. So it's important to know that you might have contracted hepatitis C and you need to get treated to get rid of it. But it can also lead to liver cancer. That's a small number of people with hepatitis C. They develop liver cancer. But liver failure, that's called advanced cirrhosis. There's real scarring and damage to the liver. The liver is stiff and it just stops functioning. But even if you're cured, even if you've been cured with the drugs, it can have lifelong health implications because hepatitis C is a lot more than just a liver disease. It's connected with a lot of different medical conditions, like an increased risk of developing liver cancer, an increased risk of developing kidney disease later on, and even kidney failure, and an increased risk of developing diabetes. Curing hepatitis C with the drugs, it really reduces the risk of serious complications like liver failure, liver cancer, and the need for a transplant. But it doesn't completely reduce your risk of developing complications like diabetes. So it's a problem. Now, what do you do from my end of things? Okay, what can you do the natural way to help with your liver? Well, zinc. The Journal of Viral Hepatitis, a study from Westmead Hospital and the University of Sydney, their liver center, the Storer Liver Center, and the Center for Immunology and Allergy Research, the Westmead Institute for Medical Research, and Blacktown Medical School. They're all in Australia. And we know that zinc is needed for your immune system. Zinc is needed to create immune cells and for immune cells to work. But zinc also helps prevent the immune system from harming you. It's an anti-inflammatory. It becomes part of a protective antioxidant system called SOD type 1 and SOD type 3. So it helps protect organs and tissues throughout the body. And it can help activate your immune system and make immune cells, but it also helps prevent the immune system from attacking your own body. Now, it's well known that zinc levels drop dramatically after you fight a virus. So there's a whole new system of protection in the body called metallothioneins. These are small proteins. They're cysteine-rich proteins. Cysteine's an amino acid. And they love selenium, they love copper, they love zinc. And they're involved with zinc homeostasis, balancing zinc effects. Like zinc is important for your thyroid function, for your metabolism. Zinc is important for healing. Zinc is important for the pancreas to release enzymes to digest your food. Zinc is important for your pancreas to release hormones, insulin and glucagon to balance your blood sugar. Zinc is needed by the immune system. Zinc is needed by the antioxidant system to protect your brain and your eyes and your heart and your liver and kidneys, etc. Zinc does so many different things in the body. It's needed to heal wounds. It's an anti-inflammatory. The immune system uses it to poison bacteria and viruses. So zinc is like really cool for the human body. And it's documented that you need these metallothioneins to work when you have a viral infection. And they confirmed that when you have a hepatitis C infection, the zinc-related metallothioneins are needed to fight the virus and protect your organs. They're mildly antiviral against hepatitis C virus. Zinc is needed to fight hepatitis C. It's just that simple. And it fights hepatitis C not just through the immune system, but through these metallothioneins, and also by protecting your body through the function of superoxide dismutase type 1 and 3. So here they say our data suggest a potential benefit of using zinc as a low-cost adjunct to current hepatitis C virus antiviral therapies, and suggest that zinc may facilitate the antiviral role of metallothioneins against other viruses. So they're finding different ways that zinc helps viruses in general, including the flu, including COVID-19, including colds, but also hepatitis viruses. So now, antiviral drugs can have a sustained effect for fighting hepatitis C, a sustained antiviral effect. They call it an SAE. But some people still go on to develop liver cancer. So here they're looking at Sapporo General Hospital in Japan, published in the Journal of Clinical and Biochemical Nutrition. They're looking at almost 800 patients who were treated with antiviral medication, and they were followed for 3 years after they cleared out the hepatitis C virus successfully. So they want to see, so these people in Japan, almost 800 people, were treated with antiviral drugs to treat hepatitis C, and they got it under control, so they want to see how long can they sustain the antiviral effect. So they found that low levels of zinc at the end of treatment was really strongly connected to developing liver cancer. That although they had cleared out the virus successfully, and they were followed for 3 years, that if you lacked zinc, you had a higher risk of developing liver cancer, even after you successfully cleared out hepatitis C. But vitamin D is also needed. Vitamin D is important for our immune system. It's so important that your immune cells can actually activate vitamin D. We didn't know this until recently. We thought the only place that could activate vitamin D was your kidneys. So vitamin D is stored in the liver, it's activated in the kidneys, and then it does all those wonderful vitamin D things. Well, vitamin D is so necessary to the immune system that your immune cells can activate vitamin D, because most of the vitamin D in your blood is not active. It has to be activated. And vitamin D allows you to regulate your immune system to fight cancer and to fight viruses better, but also to prevent the immune system from destroying you. For instance, in people with COVID-19, there's some evidence that if they lack vitamin D, they're more likely to develop acute respiratory distress syndrome, where their lining of their lungs floods with fluids, and then they have to be put on oxygen or a ventilator, and they have a much higher risk of dying. So vitamin D is really important. It's needed for your immune system to work, but it's also needed to protect your body from your own immune system, because your immune system is super strong. So, and by the way, antioxidants do not work well if you lack vitamin D, because you become inflamed and then the antioxidants get used up inappropriately. So it's really important. It has noteworthy anti-inflammatory effects. It has noteworthy effects of protecting the brain and the lungs and the heart and other tissues. It helps antioxidants work better. It's needed by the immune system. So this is different research institutions throughout Korea, South Korea. And they wanted to see if you needed vitamin D for the antiviral drugs to fight hepatitis C. So it's a multi-center study. It's 11 different hospitals. And these are chronic hepatitis C patients. They were given the antiviral drugs with vitamin D, or they were given the antiviral drugs without vitamin D. And they wanted to see that the drugs work longer and better if you were rich in vitamin D. And they found exactly that. They found that lacking vitamin D, the drugs didn't work as well, but if you were given a vitamin D supplement, they worked longer and they worked better. So there's a modest effect. So it's worth trying because it's really safe. And fewer people dropped out of the study who were given vitamin D, so it's definitely doing something for these people. Now here's another study in the Journal of Infection. Researchers from different parts of Asia, like Thailand, they're looking at circulating vitamin D and hepatitis C virus. Why are so many studies done in Asia with hepatitis C? It's a pretty common infection in parts of Asia. Hepatitis C is pretty common in parts of Asia. So they wanted to see what vitamin D did with the hepatitis C virus. So they reviewed studies from all over the world. 28 human clinical trials, almost 8,000 people with hepatitis C. If you had vitamin D levels that were good, it helped prevent a hepatitis C infection. Vitamin D levels were significantly lower in people with hepatitis C. Remarkably, decreased circulating vitamin D was found in the patients with severe fibrosis, or the patients where the drugs weren't working long term. They didn't sustain a virological effect. So let's put that in perspective. They found that lacking vitamin D, you were more likely to have an infection. Lacking vitamin D, the drugs didn't work as well, and they didn't work as long. So the virus so they weren't achieving a sustained virological control of the virus with the drugs. And they were more likely to have damage to their liver and go towards cirrhosis. The vitamin D and the zinc are important. Now, here's the last one. World Journal of Gastroenterology. These are researchers in South America. They're looking at 11 studies, 1,600 people with hepatitis C. They found that people infected with hepatitis C were much lower in vitamin D. Now, that doesn't prove that vitamin D will prevent the infection, but it does show that if you have vitamin D, if you're lacking vitamin D, you're more likely to develop a chronic infection. And they said that people with high rates of sustained virological response to hepatitis C they were much richer in vitamin D. Their level of vitamin D was at least 30. So they found that, once again, the drugs worked better if you had sufficient vitamin D. So let me give you a call to action. If you have any of those risk factors, like for instance, if you had a tattoo in an unclean environment, if you had an organ transplant before 1992, if you received clotting factors before 1987, if you had a blood transfusion in the late 1980s, if you were born between 1945 and 1965, I would definitely get tested for hepatitis C. If you're positive, in addition to the drugs, I would add vitamin D and I would add zinc to the treatment. And after treatment, I would take a form of vitamin E that's amazing for the liver called tocotrienols. It wouldn't hurt to take some milk thistle. It might help a tiny, tiny bit. But tocotrienol, a form of vitamin E, is very good for damaged livers. It helps bring the liver back and it helps protect the liver. I would also take a good probiotic supplement. So thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and please leave us a review. You can also follow us at Invite Health on Facebook, Twitter, and Instagram. And I hope to see you next time on another episode of the Invite Health Podcast. Thank you so much for listening. Jerry Hickey signing off.